Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
By 2013, Uganda's immunizable disease checklist had increased from 8 to now 11, including diseases like cervical cancer for young females and hepatitis B, among others. Uganda normally takes advantage of mass vaccination campaigns to reach bigger numbers. And during this vaccination week, by now at least 800,000 children would probably have received their vaccination jabs. But the outbreak of COVID-19 has since disrupted service delivery.
Service disruption because of the lockdown measures, service disruption because health workers may not be available. Some of them are, may find challenges with commuting from their home to the facility, and others may give other reasons not to be present.
The recent mass immunization exercise, which was declared largely successful after reaching more than 18 million children, is the measles, rubella and rotavirus countrywide vaccination. However, statistics from the Mulago Child Health and Young Child Clinic shows a drop in the numbers of children that were immunized between February and March this year. More than 300 children either missed their follow-up jabs or did not show up for vaccination.
Gradually now, when the lockdown started, it also affected the health facilities which provide vaccination for these children.
When the mothers take children, the health workers are not available. Or there are many other explanations they give as to why they will not provide the service.
And there's been a gradual reduction in the number of children who are receiving vaccination on time, mainly because of access.
The trend of our immunization performance is going down. We started observing this from last quarter of the second quarter of this financial year, where we were more engaged on the MR campaign. The returns moved down, and we went into the festive season. We also observed a downward trend, and now COVID has also come on, and it has diverted our attention.
Dr. Munube says if this trend continues, the country is likely to have a vaccine-preventable disease outbreak after the COVID-19 pandemic or concurrent infections like what is being experienced in Democratic Republic of Congo.
If we don't achieve what we call herd immunity, where we have close to about 95% of the children vaccinated, there are risks of outbreaks of common vaccine-preventable diseases. For example, in Uganda, we know about measles.
March, we only had 1 week to the end, so the impact to service could not be measured properly. Now we're in April, and we will expect the April results to be in by the 14th of May. So that is the earliest we can see the impact on our service delivery.
And the children who will miss their jabs during this period may suffer adverse effects of such illnesses.
So if, for example, I am a child who is supposed to get 3 doses of a vaccine, and I get 1 out of the 3, then the biggest challenge is this vaccine is not effective and it's not providing me with the necessary immunity against the disease. So it means when I start again, then I have to repeat that block, or if I call the full cycle of vaccines.
Our uptake of HPV is also going down, now almost for 2 cycles. Those who should have got in October would have completed in April. So they didn't get in October, they haven't got it in April. So what we are also planning is, what it means is after this campaign, we will have to do a massive catch-up campaign. A catch-up campaign, which is the recovery plan.
However, Dr. Munube says the last option to such a situation is rolling out door-to-door campaigns.
But they are very expensive and they are logistically challenging.
We will need something close to 4 billion. If we have to move village by village to to ensure that we update the immunization status of every child.
The ministry is now operationalizing the guidelines from the World Health Organization on immunization by ensuring people are protected against preventable diseases, as well as the safety of communities and health workers.
What we're encouraging is the shade for immunization should not hold more than 10 people. We also gave guidance to districts not to carry on with the common practice of making mothers gather a large number before you start opening vaccines. We said no. Once a child is brought, open the vaccine. And some of the districts have done so well, where they have decentralized the decision making, that clearance to a lower level, and a mother who has a child health card, we have not heard any one of them being stopped.
However, WHO also urges countries to see to it that if immunization services must be suspended, urgent catch-up vaccinations should be done as soon as possible, prioritizing those most at risk. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities